Aloha, everyone. Thank you for joining us today. I'm Desrae. And like Scott said, I am the mental health counselor here at Windward. Just to give you a little bit of my background, I have been here at Windward for about 5 years, just about. And previous to being at Windward, I was a mental health counselor, but in private practice for many years. And my specialty was addictions. So I have worked with many folks dealing with addiction and at various age levels, families as well. And I'm also a professor at Chaminade University, and that's pretty much what I teach, courses in how to counsel those with addictions. I was a little bit in a quandary when I developed the PowerPoint. So I wasn't quite sure on what levels of interest the audience would be at. So I'm coming from a very sort of basic foundation in terms of addiction. However, depending on the feedback I get from our participants, I can also expand. And again, as Scott mentioned, if anybody has questions that might be personal to them, then you can always wait till after. Shoot us a message in the chat and we can address your questions. And again, I'll repeat what Scott said, that if you happen to indulge any information that might be personal, we can also edit that out at the end of the recording. Okay, so I think we're ready, Scott. Okay, navigating addiction in college. Okay, I'm hoping that you all can see that. So when we're looking at college, just that environment itself, there's a huge prevalence of addiction. And a lot of it has to do with, according to the studies, there's a lot of recent studies on the use of smartphones. And one of the questions that they pose is that, what are other ways to support communication in interpersonal relationships? Because what we're finding is that the prevalence of college students becoming addicted to their smartphones it's rising because it does provide multiple channels for interpersonal relationships, and it does take the space of communication in terms of face-to-face. So if we're looking at establishing and maintaining relationships, which is one of the things that becomes a problem with any type of addiction, not just substance, but we're looking at processing addictions as well. Kind of think for yourselves, like, what are other ways to support this type of communication so that we don't become heavily involved with our devices and then lose focus on what we're really needing to actually address. And I know that's a hard one for me too, because I am constantly on the phone, because it is my way of communication, not just with students and the campus, but also, you know, my clients. So maybe I can pose that question and you can throw it in the chat. Maybe you can be creative with me and come up with ways that we can share in terms of communication and interpersonal relationship outside of using our devices. Okay, next slide. All right, so substance abuse. Now, when I look at substance abuse, and there's such a huge, I want to say, politically correct statement when we're looking at substance abuse, then we no longer call our individuals addicts who have problems with addiction. What we use in terms of that dialogue is to address those with problems with addiction. So and we have to be politically correct these days, I think, because of the way that people are receiving information, but it's also a hard one for me to get used to, because I've been doing this for over 20 years, and what we would normally call our folks are, and they're used to it, I guess, in previous years, addicts or alcoholics. And what we have to be careful is not to use that language anymore. So college students are commonly engaging in substance abuse, including alcohol, marijuana, and prescription medications, which can often escalate to addiction. So, and this is according to studies, and I think there's a reason why, there's various reasons why, and they may not have evolved in terms of the studies, but I'm going to throw this question out there, and maybe you can participate in the chat as well. Why do you think college students are particularly at risk? And I'll just give you guys a hint. There's a lot of stress in this environment. Yes, increased stress, and many new challenges and changes. You're correct, Scott. And sorry? Okay. And with that alone, since stress is often the precursor to using substance or becoming involved in behaviors that are addictive, one of the things we need to learn is how to deal with those stressors. And being in college can promote not only just the behaviors, but also the use of substances. So gaming is a huge one. And I don't look at it as a negative activity. I think it can be a well-rounded activity. And what happens when we overuse those types of activities? Well, normally with addiction, we're looking at other things that are important in our lives falling away as a result of overuse. So keep that in mind as we move forward with the presentation. Next. So the link between stress and coping mechanisms. So just like Scott said, students often grapple with academic and social stressors. And it is, I mean, being in college, you have a lot of things going on. It isn't just studies, it's family, it's relationships, it's other responsibilities, it's employment, for example. And so this is going to lead to an increase in drug or alcohol use as a means of coping. And this isn't for everyone, but in terms of the studies and the high prevalence of addiction, it's often stress and coping mechanisms that are the predictors. Lack of coping mechanisms is what I should say. And unfortunately, this can lead to addiction. So we're going to play a short video, a YouTube video with Dr. Joe Dispenza to kind of explain that.
The only challenge, I think, with addictions is that if you can't think greater than how you feel, your life will stay the same.
Yeah.
The solution then is...
I thought today I wanted to talk a little bit about addiction. So as we speak, I've been a medical doctor for 21 years. So if I look at my patient population, but even if I look across society as a whole, these days, it's very hard not to draw the conclusion that almost everyone is addicted to something, whether that be their phones, Instagram, alcohol, online pornography, drugs, whatever it might be. And so I'm interested, Dr. Joe, what's your view on addiction? What's driving so much addiction? And what can people do to try and break free?
Sure. I think it's a question worthy of a conversation. I think that we've been programmed, and it's not a good thing or a bad thing. It's just how we've been programmed. So I think behind every substance addiction or some addiction on some gaming or media or whatever, there's an emotion that the person is doing their best to regulate. So let's just say a person has been exposed to a trauma, right? And when we have an event in our life that changes our emotional state, the stronger the emotion we feel from the shock, the betrayal, the trauma, the news, whatever it is, the more altered we are inside of us, the more the brain freezes a frame and takes a snapshot, and that's called the long-term memory. And long-term memories, so we remember them because we can remember the feeling associated with them. So what most people don't know is that trauma or those series of events alters our internal state, and every time we think about or remember the trauma, we produce the same chemistry in the brain and body as if the event was occurring. Now, the body is so objective that it doesn't know the difference between the real-life experience that's creating that emotion or the emotion that person is fabricating by thought alone. And it only takes a thought and a feeling, an image and emotion, a stimulus and response, and you're actually conditioning the body subconsciously into that emotional state. And that sets the baseline of that person's emotional state. So then the person goes, God, I feel empty, I feel anxious, I feel unworthy, I feel resentment, I feel frustrated, and I don't know how to change it. So then they look for things in their outer world to make that feeling go away. So whether it's a drug, whether it's gaming, whether it's pornography, whether it's complaining, doesn't matter what it is. But let's just use a pill as an example, or a drug, a recreational drug. The person takes a recreational drug. The moment they take the recreational drug, they notice a change in their emotional state. And the moment they notice that change in their emotional state, they associate that change with what caused it, and they remember what caused it. So that starts to create a dependency. Now, I think there are degrees of addiction. Some are very physiological, receptors are modified. But when you get right down to it, an addiction is when the body has been conditioned to be the mind. So then the person, every time they start feeling the emptiness, they feel the unworthiness, they feel the frustration, they feel the anxiety, their brain creates the image of what they need to do to make that feeling go away. And the last time, or the last series of times, it was that exogenous substance or that activity that made it go away. Now, here's the problem. Let's use gaming as an example, okay? So when you blow someone up, or you break through a certain level, or you shoot someone, or you get points for whatever you're doing in a game, there's a release of dopamine in the brain, and dopamine is the reward chemical. It's the pleasure chemical. The problem is that the amount of dopamine that's released in a very short interval of time is outside of normal. So now, rush dopamine into the brain, and the receptor sites on the outside of the cell say, this is way too much dopamine than I'm used to processing. So the receptor sites actually close down. They shut down. So now, in order for the person to get that same feeling, they got to play more. They got to do more. The stimulus has got to be greater. So over time, we start recalibrating those pleasure centers, those receptors, to a higher level. Now, what's the significance of that? In the absence of that stimulation, our pleasure centers have been hijacked to such a high level that we can't find pleasure in anything. You can't find pleasure from a sunset. You can't find pleasure from sitting down at the table and having a meal with your family, playing with a dog, going to see your grandparents. Especially for a lot of children, you can look at them and you can see that something happened to them where they're just glazed over. That's because they're kidnapped by the technology. And so in order for them to get that same rush, they have to play more, they have to do more. Now, here's really the big problem. Learning should be a reward in and of itself, right? I mean, learning should be a reward. But now, for most people, they need a stimulus. They need something to drive their attention to whatever they're learning. And now attention is dependent on something outside of us. And when you capture people's attention, you capture their energy. So, and you can program them as a result of it. So the solution then is to teach people how to self-regulate. So we see people that come to our work that have had problems with addiction.
Oh, sorry, Des, you're on mute still.
So sorry about that. Thanks, Scott. So Dr. Joe Dispenza talks about self-regulating emotion, and that's a huge component when we're looking at addiction. And it truly is a sense of self in which we lose when we're looking at outside activity to mimic some of the needs that we may have based on whatever's happened in our life and it's missing. And so when stress comes to be part of that process within us, and we don't have the coping mechanisms, or we're really delayed in developing dopamine, we are going to rely on those activities or those substances to help us regulate emotion. And that's something that I've dealt with many years with my activities, with my clients, is finding things to do in which substance use or behaviors were no longer part of their life process. And again, it's something that you have to relearn. If we're in heavy addiction, for example, and we're in recovery, we go through treatment and then we're in recovery. Those times when we're not participating in the substance use or the activities in which put us there in the first place, it's often hard, and this is what I hear from many clients, that it's extremely hard to find fun in new things. So it's an adaptive behavior, just like addiction was an adaptive behavior. Living clean and sober is also an adaptive behavior. And it is quite a bit of work, but once we reach that place in which recovery becomes something that's normal, and the stress levels have become neutralized and coping mechanisms have become practiced, and they're quite strong and resilient, then we can actually look at recovery on the long term. Next. So peer pressure. So the college environment often exposes students to peers who encourage substance use or display addictive behaviors, increasing the likelihood of developing addictions. And this isn't to say that this is something that happens across the board, but when it does happen, I more than likely would like you folks to be aware of that. Some of the things that we have to be aware of is that it's a phenomenon, right? Where individuals get influenced by the thoughts and behaviors and actions of people their own age or social group. It's a common thing. So the pressure can have a positive effect as well as negative effects. And when we're trying to conform to groups, we're either going to benefit from the skills that we learn from the group members and their communication, or we're going to get dragged towards detrimental activities like substance abuse or even illegal actions. So some of the positive effects of peer pressure can be like things that you probably are already participating in, like group study. So as part of the group, you kind of learn how well, you learn things quickly as a group and probably efficiently from each other. So when we're looking at addiction, we can also learn how to become addicted. It depends on your personality. It also depends on, like I said, coping mechanisms. And one thing that the study suggests is that often what interferes with our ability to cope is our family history. So if you have a family history of addiction, you're either going to be part of the pattern or you're going to be someone that is really resistant to the pattern. And not one of them is either better than the other. I think individuals who deal with family histories of addiction actually struggle through the process. But if there's one positive influence in their life in which can distract them from that type of behavior and pattern, they're more than likely, 50% more than likely to be successful in maintaining a clean and sober life. Extracurricular activities are a good one. And this is what I tell my teens, like joining sports, getting involved in music, some shape or form. Because more than likely, if you're involved in these types of activities, and even at the college level, you're more than likely to stay away from addictive behaviors and substances. And another thing that's really interesting is personality development. So what I deal with a lot is social anxiety. And I'm not saying those who have social anxiety are more prone to addiction, but I can say that that's another area, and this is just used as an example, in which you would have to regulate your emotion or learn how to regulate your emotion. So some folks that I've dealt with in the past, their regulation of emotion could go either way. It could go either negatively or positively. And some of the ways that my clients dealt with their social anxiety was the use of alcohol, because it made them feel more relaxed and they were more socially engaging. And then others just understood the process that if I'm going to be socially anxious, I need to also engage with one or two people versus a whole group. It's setting limitations on their social activity, but increasingly opening up their social venue to adapt to the environment. And again, that is through therapy. So I'm not saying that everybody who's going to have addiction influencers need to go through therapy, but some sort of education at any level about substance abuse or addictive behaviors is really helpful. So what can happen with peer pressure in terms of the negativity, again, is the influencing, but also under peer pressure, we're more prone to indulge in behaviors that aren't going to help us, or even antisocial activities. And then what happens as a result of that, that's just one example, is that we're prone to probably neglecting our academics. So if we're involved with a group that's probably not doing the best in school, we're more than likely not to do the best either. And so what might happen is we're going to spend more time with those friends, and then we're going to shift the focus from studies. And then obviously it's going to impact our academic results negatively. So how do we handle peer pressure? Well, like I said, becoming educated about substance and becoming educated about possibly the anxiety that you may be going through, or some emotional regulation that you might need to learn about, is really empowering. And then surrounding yourself with positive influences and having open and honest communication and being assertive and just saying no, and understanding and recognizing the potential damage of negative peer pressure. Next. So mental health. I could this whole rest of the presentation could be on mental health, but I will bring it in and just be very precise in saying that students with pre-existing mental health issues, such as depression or anxiety, may be more susceptible to developing addictions. And what I mean about that is there's always a precursor to severe addictive behavior. And trauma is one of them. I would say that's the most prevalent, I want to say, experience that most of my clients have had is trauma. And so what happens to the body is that when we have gone through some level of trauma in which our body remembers the trauma, we may have done a lot of work up here, but the body can often remember the trauma. So if we're in a state of overwhelm, or we're in stressful conditions at school, and it may not be due to anyone outside of us, it may be our own thinking, what we're going to do is probably shut down and start to feel the anxiety. So when we have anxiety, we can gauge it like saying extreme to mild, of course, but anxiety really is anxiety. And so if your body remembers anxiety, your heart starts to beat, you start to sweat a little bit, you have racing thoughts, for example, oftentimes the triggering piece, which could be a thought, is going to take the body through that process. And so what we have to learn in that event is how to bring it back down. And oftentimes it's just some mere exercise of breathing, learning how to breathe and slowing it down, or actually talking to somebody that can help you learn that process. So some of the signs that if we don't take care of that process, for example, some of the signs that we see as instructors is that we're going to notice students skipping classes. We're going to notice poor personal appearance. We're going to notice the avoiding process. We're going to notice that maybe they're no longer participating in activities that they once enjoyed. We're going to notice that the way that they appear, right? So if you're needing to drink and possibly game to relax or have a good time, that's something that you need to actually know. We're not going to automatically see that in the classrooms, but this is for your awareness. We can see things like bloodshot eyes and maybe probably poor concentration or memory issues. We can see that, but things that maybe one can be aware of when they're overusing is that there's going to be withdrawal symptoms. Like headaches, cravings, or even depression. And the depression is due to the dopamine levels a lot of times. Like the body will not replace the dopamine levels unless it's been clean for a long period of time and you start to engage in activities in which produces the pleasure principle. And Dr. Joe Dispenza explained that earlier. So other things that can be involved with prolonged use are like legal troubles, often DUIs, or even accidents. So again, talking to someone about your issue may not be easy, but especially if you don't think you have a problem. But if someone is out there that says, hey, you look a little, maybe we should talk about it, open up to them, and because that person is probably really concerned. And of course, if you trust them. All right, so next. Accessibility. So the easy availability of drugs, alcohol, and internet access on college campuses can contribute to higher rates of addiction. So what does that mean? Of course, we all have choices, right? I mean, we're going to choose to do whatever we're going to choose to do. But accessibility is a huge one. So in my practice, in treating my clients, the number one issue I had with alcohol, if I had those clients that were having issues with alcohol, was accessibility. And it was mainly because it was available everywhere. I mean, you couldn't cross the street without seeing it in the liquor store or the convenience store or, you know, the grocery store. And they would have to access these points of establishments for their own needs, right? They would have to go to the grocery store, they would have to go to the pharmacy to get their medications, whatever the case is. And so the hard part is actually recognizing, like, okay, I'm going to go there and I have to have these coping mechanisms so that I don't make the wrong choice. So accessibility in college, like we have a lot of choices, like I said before, but the best thing that I can say is that if you're going to come across those that have the availability of drugs and alcohol, just know ahead of time that you're probably going to have to make a choice and just kind of decide what it's going to be like tomorrow. If you choose to participate, always look at what is it going to be like tomorrow. And so what I teach a lot of my clients is that let's just play the recording out to the end instead of looking at, oh, this is going to be fun, I'm going to participate in this, I'm going to have a great time, and then the recording stops. So one thing to do is just play it out to the end, because usually what happens after prolonged use is that we're not going to feel good. We're probably not going to finish our assignments. We're probably not going to show up at school, and we're going to feel drunk. So play it out. And so one of the things I get asked a lot of times is, what drugs do college students abuse most? Now, it can vary, and I'm just going to generalize this. So one of the ones that's most used is marijuana. And with the recent passage legally, it can be used not recreationally, excuse me, but medically. But that's not to say that the recreational passage won't come soon. So that kind of worries me, but that's a whole nother lecture. I won't go into that. And then MDMA or ecstasy is another one that's used a lot. And then Adderall, they call this the study drug, and this is used to help people stay awake, especially, well, obviously for those who don't have ADHD, this has the adverse effect of keeping you awake versus calm. And then another study showed that about 20% of college students were exposed to opportunities to use cocaine in the past year. And then we have painkillers and opioids. One of the things I want to just bring up and very, very briefly discuss is fentanyl. So that's a huge one. And there's a lot of detrimental effects as the use of fentanyl is becoming more prevalent. So, and it doesn't take much to have a severe effect. And that one, it worries me a lot because of the deaths that are happening as a result of the usage and the lack of awareness. So I'm just going to throw that out there. Let's just be aware that fentanyl is an absolute no. There's no way you can use it recreationally successfully. There's no way. Okay, next slide. All right, so academic performance. So addiction can have serious negative effects, right? And it's going to be mostly due to impaired cognitive function. You're going to have reduced focus, and then, of course, increased absenteeism. And we kind of briefly went over that prior to this slide. So did you ever think that the extensive use of social media might actually cause exhaustion and might actually detrimentally affect our academic performance? It can. And a recent study showed that the way that it affects students is that there's a result in cognitive overloading if you've been exposed to massive amounts of information. And so therefore, students who are addicted to exciting and interesting online social activities, they're constantly encountering a significantly higher neurological load than those who are not addicted. So therefore, they're more prone to experiencing fatigue. And in addition, persistent mental fatigue has been shown to lead to increased distractibility and poor information processing. So it's not just the substance, it's also the overuse of your devices. Okay, next slide. And then physical health. So students struggling with addiction are going to experience deteriorating physical health due to neglecting personal care, poor nutrition, or the direct effects of substance abuse. And that's an easy one. I think you all get this. I mean, the body can only take so much, and the brain as well as part of the body. And so when we don't take care of our body, often what happens, it's going to talk to you. Your body always talks to you when you're lacking self-care. It's either your body's either going to have some sort of pain somewhere, your blood pressure can increase, right? You may be getting physically sick with the colds and the flu, your immunity levels start to decrease. So when you don't treat the body properly, of course, it's going to show effects that either are going to keep you out of school, it's going to keep you distracted, and until you take care of those issues, which most have been in my practice, which most have been, that's the number one thing. Let me go back a little bit. When clients come in to see me, that's the first thing I ask them is, when was the first or last time that you went to see a doctor? And some of them have not engaged in that process, and it's been years before they've actually seen a doctor. And so that worries me a little, because we're looking at things that they might not be seeing, and yet they're abusing their body continually, which could really have some detrimental effects. And so one of the things that I've seen most prevalently is high blood pressure, and then also diabetes. Okay, next. So what are the treatment options? So for students struggling with addiction, treatment may include counseling, support groups, medication, and behavioral therapies. One of the things that I think we're doing here that's impactful is we do have groups here, our sobriety groups, which I find that it's a really good support process for many of us who are early in recovery, because it brings a commonality to the struggle, but it also brings a lot of support to the healing process. So if you look at your campuses, one of the things that I don't see a lot of is the and again, this isn't the system's fault. I think this is just the way most environments actually address addiction, because we have a lack of resources here on the island. And it might be due to the budgeting issues. I'm not quite sure where that stems from, but there's always a wait list for treatment. And so that tells me, and I've been doing this for 20 years and it hasn't changed. There's always a wait list for those that need treatment, which tells me the issue is prevalent and it's still the same, unfortunately. And so the rate of recidivism in treatment centers is really high in terms of the comparison to the rate of success. So the rate of success generally now across the board, and it isn't due to just one treatment center, it's due to the generalization of all of them, is only 30%. And that's quite low. So, but 30% to me, I'm cheering for that because I'm looking at success. But if we're looking at the success of treatment in its entirety, it's really up to the individual to want to receive the treatment. And many of my clients in my private practice were often forced. They were mandated to receive treatment, which was good, but it wasn't always the best, because until you're ready to receive the help and make some lifestyle changes, oftentimes treatment is not successful. So again, I want to just say it's up to the individual. The resources are there, even though there's wait lists. But if you're really wanting the treatment and to be clean and sober, you're going to wait and you're going to go through the process. Okay, next. And there's our references. So Scott and I had a discussion on providing resources for our participants. And so I will verbally state it. So my name is Desrae. I'm here at Windward Community College. If you have any questions or you need any kind of resources that are relevant to the information we talked about today, please reach out to me. If you need assistance, as always, on your campuses, you have your mental health counselors, and I'm sure you should be familiar with who they are. But if you are not, please reach out to me and I can connect you. I do have some resources in Drive that Scott is going to share with you. There's coping skills for addiction. I think it's 3 pages. And let me go there, and I need to kind of check it out too. So coping skills for addictions, it's just a brief source of information on social support, diversions, and it kind of gives you a prompt on some coping skills that you might actually use, and then a little bit on prevention, and then more information on journaling, imagery, deep breathing, and healthy lifestyles. So that's something I wanted to share with you. And then I also had, because I teach at Chaminade, I have my students develop community resources. And so I chose one that 2 students I particularly loved their collaboration on resources that we have on Oahu. So that is also something that Scott's going to share with you through a link. And it's detailed and descriptive in terms of the resources that we have here available, the eligibility process, and also what type of population that each of these resources would align with. So please look at that if you're interested. And then I had one more. So the Cage Aid is a questionnaire, which is also in I think Scott's already shared the link with you. The Cage Aid questionnaire. Now this one I'll just briefly go over, and then I'll open up the floor to questions if you have any. It asks 4 questions, and those 4 questions are going to determine whether you're at risk of addiction. So, it's going to ask about drinking and drug use, but I'm going to go one step further and say that this questionnaire here, which is just a questionnaire now, it's not an assessment, which is totally different. Assessments are more intrusive. It takes more time, and then we can kind of narrow down where you are with your addiction. But this one here is just kind of like a screen. So it's going to ask you 4 questions, and they're either yes or no. So if you are going to take this questionnaire, and let's say all your questions are no, or your results are no, then of course, yeah, you don't have something that we might need to investigate further. But if you have 1 yes, that justifies. If you have more than 1 yes, then we're probably looking at an issue. And of course, if you have 3 or more yeses, then you're probably needing to talk to someone about the issue, and not necessarily having to do with drinking or drug use. Let's say that you need to cut down on your gaming, or that you're annoyed by people criticizing your gaming, or you felt bad or guilty about your gaming. What we're looking at is the severity. So 1 yes is going to say, yeah, we might have a problem. 2 yeses, yeah, we probably do. 3, yes, for sure. And 4 yeses are going to mean absolutely. And then we take it to the next level. So that's just something for your personal use. If you want to pass it on, please do. These are good questionnaires, and often you might see these at doctor's offices just so they can gauge where you're at, but not necessarily treat you for it, but then they can also give you resources. And I think that's all I have in the drive to share. So at this point, let's see, I think there's, yeah, thanks, Scott. I'm looking at the chat right now. That's great. So are there any questions? Does anybody have questions at this point?